backdrop, we have about 6,000 covered lives in our health plan. About half of those employees, half are dependents. About 30 years ago, we were expecting a pretty good decrease in our fully insured insurance program. And we expected that because our claims were far, far below what our premium levels were. And when the insurance agent showed up and gave us an increase, we were quite perplexed, frustrated, and it ended up being the straw that broke the camel's back. We asked why our premium was going up, and they said, well, although your individual claims were much, much lower than most folks, you're in a pool, and the pool had a really bad year. And we said, ho, time out. We didn't know we were in a pool. We don't want to be in the pool. And they said, well, you have to be in the pool. That's the way it works. And so we said, no, it's not. We're out. We had been watching the lack of sustainability that we were enduring, and we just ran it out about 10 years, and we said, wow, if we don't get off this this runaway train now, we're going to be in deep trouble, 5, 10, 15, 20 years from now. And so what we did is we became self-insured. We hired an independent third-party administrator. We did some direct contracting with hospitals and specialists and others, and we opened our on-site clinic. Now, although when you fast forward to today, those are some of the key ingredients that are needed in order to cut your cost in half. We didn't know that at the time. I think we just got fantastically lucky. But anyway, we've stubbed our toes along the way. We've not been perfect. Most of it's very commonsensical. We have focus groups. We read periodicals and implement things. We ask our doctors at our on-site clinic, not doctors, we ask our entire staff at our on-site clinic, what are some things that they would like to do or maybe have always dreamed to do, and that's the basis of how we've implemented certain different solutions over the years. Our cost savings has been, again, we're not gigantic. We're about 6,000 covered lives, but our cost savings have been about $500 million over the last 30 years. That's not all linear. We've gotten most of the savings over the last 15 years. Our costs are about roughly half of what our identical demographic would experience in the conventional healthcare setting. However, our benefits are much richer. Typically, when you cut your costs in half, there's a commensurate cut in benefits. And that hasn't been the case at all. Our benefits, we think, are some of the richest in the country. We don't have any deductibles, zero deductibles, zero coinsurance. 90% of our drugs do not cost our associates anything at all. What we do is we try to lower barriers to care wherever we possibly can. For example, if our co-pays, not coinsurance, but if our co-pays were too high, folks might not buy the medication. They may not come to the doctor's visit, that sort of thing. And so we keep those at a very low level. Premiums are at a very low level for our payroll deductions. Transportation is sometimes an issue for some of our associates. And so if they don't have transportation, we pick them up. We take them to doctor's visits. There's no reason why one should miss a doctor's visit. There is a laser-like focus on prevention. And the traditional healthcare model starves the quarterback of healthcare, which is the primary care physician. And we thought that was odd. So what we do is we spend a disproportionate amount on our primary care, and that yields tremendous savings to our program. We have a nutritionist on staff, a podiatrist, and let me talk about the podiatrist just for a second. You know, again, going back to those commonsensical implementation of our different solutions, we in the hotel business are on our feet all day, and we're constantly telling our associates, please smile at our customers and tell them, welcome them and just have that warm feeling about you. And one of our folks in a focus group said, well, my feet hurt so bad it's kind of hard to smile. And we said, voila, we will have a podiatrist, on staff. And so that's kind of how that came about. And getting to some soft cost savings, that those smiles and better productivity and that sort of thing. We've never measured that. Our costs, when I mentioned they're roughly half of what the identical demographic would experience, we don't measure in our extremely low turnover rate, our productivity rates and that sort of thing. So I suspect the real number is further south than that. But again, nutritionists, podiatrists, we have radiology, we have pharmacy, about 250 of our most commonly prescribed drugs. As soon as someone walks out of the doctor's office, we put that right in their hand, and then the next one comes to their doorstep, or they can, drop by a local pharmacy and pick one of those up. We have Zumba, Tai Chi, spinning, any type of almost any type of activity that you can imagine, no cost to the associates. And we have those at each of our hotels. So in the morning, sometimes I'll do Tai Chi. Afternoon, I've tried the Zumba, but my hips don't swing well. So, but spinning, in the afternoon, by no stretch is our each of our associates totally locked into doing that. We still have we're still like many of you. We have a lot of folks that we trying to drag that horse to water, and not all of them drink. But we feel like if we can touch them from as many touch points as possible with activities they may enjoy, we have a better chance. Our chronic conditions compliance rate, so doing what the doc says for chronic conditions, it's 2 to 3 times the national average for hypertension, diabetes, and cholesterol. Again, we're not perfect. We have some folks that just, they just don't, they won't listen. We just try to continue to be creative, and sometimes more than just being creative, being sure that there's a good relationship between our provider and the patient. That's huge. We, in our early stages, we didn't think it really mattered that, I might see Dr. A one visit, and then, the next Tuesday I go see Dr. B. But we, again, stubbing our toes over the years, we've learned that building a strong relationship between the provider and the patient helps to achieve some of the levels of compliance that we've that we have. Our turnover rate is much lower than our competition, and it's interesting because sometimes I leave that toward the end, but a lot of folks have told me I should kind of lead with that because of the huge cost of turnover in a business. When you have to train a new, employee, et cetera, it's extremely expensive and draining on the rest of the employees in the company. And our turnover rate is about 14% compared to our competition at 30, 40, 50, sometimes even north of there in some of our restaurants. And so, that's a huge savings we feel. we we just encourage anyone who has an, for example, an on-site clinic or some of the programs that we have, we encourage them to just be sure they're using those as efficiently as possible. Our second to third largest line item expense is healthcare. We are in the healthcare business. Everybody needs to understand that we're all in the healthcare business. We need to understand it. Our CEO and our CFO needs to understand it to the level that our benefits managers understand it in order to get out of the mess that we are in. We do a lot with our savings, a lot of philanthropy, and so we've adopted 2 neighborhoods, inner city, underserved communities with the savings that we've had with healthcare. And our hope is we can by fixing healthcare and using some of those savings to fund underserved communities, and I'll tell you a little bit more about that in a second, we can really solve 2 of the largest dilemmas in this country. One is healthcare, and one is income and education inequality. So our first project started 25 years ago, where we adopt a neighborhood, and then we provide free daycare to every 2, 3, and 4-year-old child. And in exchange for providing daycare to those children, we ask the parents if we may tutor them. And so we tutor them, and when they come to kindergarten, they can read better than my children read. And we read a lot to my children, but they can read better than my children read. And then we hook ourselves to we're joined at the hip, just like we are in healthcare with our health navigators and our healthcare coaches joined to our patients. We're joined to the hip with these little children, and we tutor them all the way up through high school. And so graduation rates have gone from this crime-ridden community from 50% to 100%. And then when they graduate high school, we pay for their college, full boat, tuition, books, room, board, coming home during the holidays, travel, everything. And so crime is almost non-existent there. Graduation rates 100% on high school. We now even have our second generation coming in. So that 2 or 3 or 4-year-old child back 25 years ago now graduated from high school and college, now has a child that's in the program, and our costs continue to go down annually while the number of the folks that we graduate continues to increase. And you say, wow, how could that be? We're paying for their education. Well, we don't have to pay for their education when they win their own scholarships. And so we've since adopted the largest inner city neighborhood in the epicenter of Orlando, and we're hoping that others may do this. We're hoping others certainly jump into the healthcare part of what I've been talking about and save the healthcare system. We're also hoping folks do some of the philanthropy as well. So our thought is that we can change the face of America, one underserved neighborhood at a time. Larry, are you there?
Yes, I'm right here.
Larry, any questions that you may have for me, or maybe the audience might have for me?
Well, we haven't gotten any in yet, but when I first met you and visited the center down in Orlando, it really was a cutting edge facility. And I was wondering if you could just share some lessons learned for companies, and why did you go to self-management as opposed to contracting with a vendor or provider, and what makes for a successful session, or what are the landmines perhaps that could cause people or these centers to fail, or any pushback that you had from your workforce?
Yeah. So I think one of the key things at the beginning was that, and it still remains something very key to our success, is the firewall between our on-site clinic, because we run our on-site clinic. We don't have a third party doing that. But there needs to be a firewall between that on-site clinic with that clinical data and our hotel leadership. Now, the hotel leadership gets information in aggregate form, but we don't know if Larry has a certain, disease. And that is absolutely crucial, we think, because even at the very beginning in some focus groups, we had some folks with AIDS, and they said, am I just going to be coincidentally in the next round of layoffs, when you find out that I have, AIDS? And leadership really took that to heart, and the firewall is impenetrable, we feel. So that, I think that's crucial, especially when you're running your own on-site clinic. If you have a third party doing it, it's a little bit different, but you never know what employees are thinking. We've stubbed our toes along the way, but we did feel that that the insurance, again, you can do this with, you can have a regular standard insurance company and still have your on-site clinic. But we have just found out that these companies are so large and just have their own way of doing things, to where we felt that going with an independent third-party administrator was a little bit easier for us. And our leader is a bit impatient sometimes, and so when we're dealing with gigantic companies, and it takes a long time to do a certain implement certain programs, we just felt it was better to work with a third-party administrator. We going back to stubbing toes, we had a preemie many years ago. Preemie's fine, doing just great now. But the cost of that was about $1.5 million, and that kind of rocked our world. And what had happened was we kind of practiced the same medicine that everybody else out there is practicing. When that pregnant mother came to us and tested that she was pregnant, we just referred her out to the OBGYN and just forgot about her for a while. She's in that person's care, at least for that particular situation. And what we didn't know is the person wasn't coming to their visits. And what we didn't know is that well, we did know this, but when the person didn't come to their visits, bad things happened along the way. And so now we as soon as someone is pregnant, we give them a wonderful little care package. Our CEO calls them and congratulates them. We have all sorts of connections to the OBGYN to be sure everything is working out quite well. We do have a little card that the employee signs, allowing our CEO to reach out. So there are some times when our CEO does not reach out to say congratulations, but it's proven quite well. So those are just maybe some of the challenges that we've had along the way.
We had a question. Can you share more about why and how you started investing in children's education?
Our leader is, I'm not so sure why, but he has a passion for healthcare, for hospitality, obviously, and a passion for education. And he kind of felt like, it's not really income inequality as much as it's education inequality. When you try to solve the income inequality problem, you can go in too many directions. But when you boil it down, if you feel that this is the right answer, if you boil it down to where the big problem with it is education, then you can really start focusing on education, and that has given these communities hope. And once they have the hope, it's just amazing how it all plays out. And we kind of stumbled into how it all played out. And maybe we got a little lucky, but it's worked quite well.
Great. So where do you see your program going in the future? How will the health center and its programs change, either in light of COVID or what you might have planned for the next phase of your development?
It's interesting. Every time we feel like we've squeezed out all of the inefficiencies in our program, we get a kind of a humble slap to the forehead, and we learn that we're not doing certain things efficiently. And so, there's just this ongoing cultural desire to continue to get better and better and better. And so I don't know exactly what we're going to do tomorrow, but someone in our health center or one of our employees who is a patient will raise their hand and go, "Hey, what about this?" And so, Larry, I think we're going to do, something about this next week. I just don't know what this is right now.
In your location in Orlando, you've got people living, I assume, all through the metropolitan area. I know the facility I saw, which was several years ago, was located near one of the resorts. But how do you reach all the dependents and families? Have you developed additional settings, or do you have relationships with, say, immediate care centers or others to provide that? Are you adopting some kind of near site or virtual strategy as well for more people as they expand beyond your location?
So most of our base doesn't have a problem getting to our facility where anytime someone is outside of kind of the geographic area, we allow them to go to other physician offices. But quite frankly, there's only a few, and we are in the process of looking at DPC, direct primary care facilities for them to go to, instead of just another doctor that practices kind of old-fashioned, sick care. But small minority are still just going to the average doc out there, and we are trying to get our hands around getting those folks in the care of DPCs that align with what we're doing. It won't always be completely consistent, but at least the general theme will be there. And as far as kids who are off at college and stuff like that, they're just really tapping into the mediocre healthcare that's out in the marketplace. Because for them, it's a little bit difficult to just work out contracts for, 2 people in Cincinnati to go to a DPC. So, as the DPC world evolves, our hope is to have few of our associates going to our medical center and them going to somewhere right around the corner from them, giving them great convenience and great care.
Great. Last question that I've got for you. I don't think you charge anything for any of the services you provide. It's always a question for employers. Should people have skin in the game, or will they not show up for appointments if it's free? How did you address that, and how's it worked out for you?
Yeah, we started off with 0 copays, and we're still on the clock when we're getting our care. And so with the 0 copays, you know, and being on the clock. We didn't have any problem getting people down there, but you know, we had to kind of tighten up a little bit. So we still have them on the clock, but we do have a it's either a $3 or a $5 copay, because we do feel symbolically that they do need to have some skin in the game. And it didn't bother us as much because their premium for insurance is about $14 per week, and just hardly any out of pocket. And so we thought that was a good idea.
Great. Well, Ashley, thank you so much for joining us, taking time out of your day to share your experiences and your knowledge with our participants here. Rosen Hotels and Resorts is a great host. If you ever want to visit their centers, just contact Ashley. He'd be glad. He's very proud to show you around, and I think it'd be a great experience. I do want to thank everyone for attending.